Good day, everyone, and Happy New Year. Happy 2023. We're going to start this new year off with a management of care question within the category of the NCLEX-RN exam. And this NCLEX-RN will change, the test plan will change in April of this year. So we're going to look at the topic within this category: assign and supervise clients provided by others, the care of clients provided by others, and those others are the LPN or LVN, assisted personnel, or other RNs. So first thing you want to do is break down your case event. Who is my question about? Who's my patient? Or what is the subject? In this case, our subject is the nurse manager. And where is this nurse manager at? She's on a med-surg unit. So medical surgical patients that get put on those floors. And what is she trying to do? Assign care to a nurse. Who is our nurse? A nurse who floated. So she's going to float to med-surg. But where is she coming from? An L&D unit, labor and delivery. So she's used to dealing with our young patients or our middle-aged female clients who are delivering babies, and all the disorders that come with maternity, pregnancy-induced hypertension, gestational diabetes, preeclampsia. So all those different disorders. So we want to focus on that and being able to choose the best patient for her. Keep in mind, she sees patients being delivering naturally and as well as C-sections, right? She has to take care of clients post C-section. So break down your query next. What is your question really asking you? Which client would be best? This is a positive query. Who is best to assign to the labor and delivery nurse out of these 4 patients that they give us? We're going to focus on the process of elimination. Eliminate options that we know are incorrect. Option A, the client who had an appendectomy and has prescription for ambulation. This is pretty status quo, right? Getting her up after an appendectomy, it's a abdominal type surgery, either it's laparoscopic or open, but she can assess their abdomen and assess when the patient is stable enough to get up and ambulate. That's a post-op patient appendectomy. So for nurses who float between units, we want to think of the functions of the assessment. We want to look for expected outcomes with the assignment. We don't want to give her somebody unstable. We want to think about the clinical condition of the patient, omit specialized care that will be more specific to med-surg and higher acuity patients. Think of the age of the patient, the accountability in taking care of that patient, and does that L&D nurse have the knowledge required to deliver the task to take care of that client. So for this one, this is a good one for her. Pretty basic status quo. Option B, the client who had a right below the knee amputation and has a surgical drain. You really don't see labor and delivery nurses taking care of surgical drains, right? Because they're delivering babies. A right below the knee amputation requires a certain type of positioning, post-op care. So this is more specialized care than we would expect for her. We're going to eliminate option B. C, the client with a GI bleed, gastrointestinal bleed, and has a prescription for blood transfusion. Even though she does see patients who may bleed out after delivery of a baby and may need blood transfusion, if they're very unstable, they'll probably get transferred. But this is a possible, but we do know between A and C, C is a little more unstable. Ambulating a patient is a little bit easier than giving a blood transfusion, all the things that go with that, and the medications that need to be given for a patient having a GI bleed. Option D, the client with a pressure injury and requires wound care. L&D nurses are not focusing on pressure injuries. Those patients were probably immobile who developed a pressure injury and requiring a dressing change for wound care of that pressure injury. We're going to get rid of D. Many clients I have will choose option C because they're thinking maternity, bleeding, blood transfusion, that they see a lot of blood and they just focus on that. But between A and C, who is most stable? A is more stable. That is a patient who she can take care of post-op appendectomy and get them up and assess whether they're able to ambulate safely. So we're getting rid of option C, and that will get you down to option A as your answer.